Hi, hello everyone. Welcome to the second session of the morning. I'm Emma Norris, I'm the Deputy Director at the Institute for Government. Now, you might be familiar with IfG's Performance Tracker project, which looks at how services are performing on a regular basis. It's supported by the Nuffield Foundation. Now, today we published new analysis looking at the likely impact of the budget on the performance of public services. And we've got the experts from the team who build Performance Tracker and write those chapters to talk you through what we found. So we've got Stuart, Hoddinott, who leads our work on health, Phil Nye, who leads our work on education, and Cassia, Rowland, who leads our work on the criminal justice system. They're each going to talk through some of the kind of overarching findings from the Performance Tracker analysis of the budget, and we'll talk through some kind of service-specific findings. That'll take about 15 minutes, and then we're going to go straight to the audience after that to take questions from you. If you are joining us online, then you have the advantage of being able to ask questions any point from now, so please start submitting them, and I'll make sure to take some from the audience as well. OK, so I think just leaves me to hand over to you, Phil.
Thanks, Emma. So the first thing to say is that this is a substantial increase in day-to-day spending on public services that was announced in the budget. The growth between 2023-24 and 2025-26 is more generous than any spending review since 2002. In the report that we published this morning, we compare funding to demand pressures in the different public services that we look at. And we found that over this year and next year, in all services, bar the police, funding will increase by more than demand does. Beyond this, so looking further into the future, we have to make more assumptions, make assumptions based on what we know existing government commitments are on health, education, defence, aid and childcare. And the picture looks less rosy for the period from 2025-26 to 29-30. Over that period, only the NHS will see funding increase by more than demand, and things look particularly bad for the criminal justice sector. That means that over the whole period that we looked at, so 2023-24 to 29-30, funding for the NHS we expect to grow by more than demand. For local government and for schools, we expect them to be equal. And for criminal justice, we expect demand to grow by more than funding does.
Brilliant. Thanks,
Great.
Phil.
Thanks.
Stuart.
I'll now take us through the capital spending allocations. So first of all, I think it's worth saying the budget reversed the planned decline in capital spending that were penciled in by the last government until the end of 2027-28. And capital spending will now increase more quickly than resource spending until the end of 2025-26, reversing the trend of the last decade. Given underinvestment in capital in that decade, this is a welcome shift in approach and should go some way to addressing some of the drivers of poor performance, including a lack of maintenance spend, a lack of space in the hospital and prisons estate. There were some relative winners and losers from this settlement, as you can see from this chart. The MOJ and the DHSC will end up with capital budgets higher than at any point outside the pandemic since 2004-05. And while the DfE is set to grow, the DfE's budget is set to grow more quickly than any other department in 2025-26 by 19% in real terms, this is from a very low base. 2024-25 is the lowest budget for the DfE since at least 2004-05. If we go on to the next slide. Thanks, Philip. I'll briefly try and talk us through the NHS settlement. So as Mike said, it is a very large settlement. It's about 4% per year in real terms between 23-24 and 25-26. But I think that needs some contextualisation. That is roughly in line with what we were expecting for the service, given the government's commitments on the long-term workforce plan. It's also roughly in line with the historical average increase in spending on the service since the late 1940s. I think there's also a point that Mike made, which is worth bringing out, that the spending increases don't necessarily translate automatically into improved performance. The government's increased spending on the NHS by about 4% in real terms per year since 2019. Despite that, hospital performance has declined significantly in that time. That's due to some real productivity issues in the service, due to a lack of maintenance spend, poor IT systems, a lack of bed capacity that are all the result of capital underinvestment that we've just discussed. And as we can see from this chart, the maintenance backlog in hospitals is now larger than at any point in history and now larger than the entire DHSC capital budget for 25-26. Given that, it might be that the increase in capital spending in 2025-26 has a larger impact on performance in the long run, but it might take a while for that to materialise. So if the government's hoping for improvements in performance in 2025-26, it might be waiting for a while. Also worth noting that the budget was very, very hospital focused. There was very little in there for general practice, community care, mental health, adult social care or public health. And that is a continuation of past trends. And in some ways is understandable given the short amount of time between the election and the budget. But the government will have to change its approach in the spending review if it wants to make a meaningful improvement in performance by the end of the Parliament. Should we go on to the next slide? I'll also talk us through local government quickly. So local government was one of the relative winners of the budget. We expected grant funding to fall in line with unprotected spending under the previous spending plans. The government avoided that by increasing the overall envelope and will now increase core spending power by 3.2% in real terms in 2025-26. That's roughly in line with the average annual increase since 2019 and will still leave local authorities roughly 9% worse off in real terms than they were in 2010. In that time, demand for local authority services has also massively increased. The population has grown by about 12%, and the over 65 population, a key driver of demand for adult social care, will have grown by 31%. Local authorities now spend close to 3/4 of their budget on adult and children's social care alone, up from about a half in 2010. That trend is only likely to increase with rising demand for those services and homelessness and SEND services. The rise in the national living wage and the NICS increase will also seriously hurt local authority finances in 25-26. That's because they rely so heavily on private providers, particularly for adult social care. Higher fees from those providers will almost certainly wipe out the majority of the increase in spending power in that year. It's also worth saying it's important how the government distributes that funding. The worse off local authorities are about a quarter worse off in real terms than in 2010, and the government has a chance to rectify some of that at the local government finance settlement later this year. Beyond 25-26, we project spending increase about 1.2% per year in real terms, driven entirely by rises in council tax as grant funding falls in line with unprotected areas of spending.
Brilliant. Thanks, Stuart. Phil.
And on schools, the government's making an extra £2.3 billion available in 2025-26. That's smaller than some of the increases that we're seeing in other departments, but it's worth saying pupil numbers are starting to go down nationally. So this is definitely, this is a real terms per pupil increase in funding. Now, a slight complicating factor, if that is overall school spending, the government has said that about 2/5 of that is going onto so-called high needs funding. High needs funding is for funding special educational needs and disability provision, and also alternative provision. And so there are huge problems in terms of access to appropriate SEND services, and there are massive financial problems. Councils building up large deficits because of their spending on SEND services, and so this has been welcomed by the sector, the extra money going into SEND services. It does, of course, mean that it cuts into what is available for mainstream schools at the £2.3 billion that's been made available.
Thanks. Cassia.
So I'm just going to start with a bit of context on the criminal justice system. So things are pretty dire at the moment in terms of performance. It says something that the police, who've got historically low levels of trust and confidence, been racked by scandals, are maybe in the best position of the criminal justice agencies. So criminal courts, prisons and probation are all failing to meet demand and fulfill their kind of basic functions adequately. And rather than improving, performance has consistently been heading in the wrong direction. So what did we see in the budget? Well, I'm going to take these one at a time. This chart shows our projected demand and projected funding based on what was announced in the budget. So the Home Office as a whole is going to be facing cuts in real terms. These are planned mostly to fall on asylum, and the government has committed to continuing investment to maintain existing officer numbers. It's not clear if that's going to amount to a real terms funding increase. And again, the increase in employers' national insurance contributions is going to have a really significant impact on forces, and one that's very unevenly distributed on different forces based on their workforce size. So we're expecting police performance to be at best stable through 2026. The Ministry of Justice, by contrast, was one of the winners from the budget, with a 5% real terms increase in 2025-26, more generous than most other departments. What we don't know is how that's going to be split across the different agencies that the MOJ is responsible for, so courts, prisons, and probation. We've assumed here a flat increase across the board, but in practice that is likely to be concentrated on immediately stabilising the situation in prisons and probation, which is so severe. That should help stabilise performance in the short term, but as you can see over the longer term, the projected demand increase in prisons is so substantial that funding can't keep up with that. In Crown Courts, sitting days have been capped this year at 2% below last year, which means that the case backlog is likely to continue to grow, undermining access to and quality of justice. And it's not yet clear what that's going to look like next year, but the potential pressure on prisons caused by resolving that Crown Court backlog does mean that the situation may well continue to worsen in the criminal courts. Not shown here, but worth mentioning, is there was a significant increase in the Law Officers Department, which funds the Crown Prosecution Service, and that should help address the kind of severe pressures on pay and demand there, as well as improving victim engagement. But from 2026-27, the picture is more concerning across all of these services. The increases that we're seeing this year and next will not be sufficient to turn performance around, and demand for most services is projected to continue growing, particularly prisons and police forces. Even if the planned reforms to boost productivity and reduce demand in prisons are successful, they're going to struggle to compensate for such a large mismatch between spending and demand. Given that without additional funding, we would expect performance to fall again quite sharply from 2026-27. Next slide, please. So what are the questions for the next spending review after this budget? Well, number one is, can the government recruit and retain staff without busting its budgets? So Labour quite quickly accepted above inflation pay recommendations from the pay review bodies to resolve ongoing industrial disputes and improve recruitment and retention. But many key staff groups, doctors, nurses, teachers, police officers, have seen pay decreases in real terms or relative to the private sector since 2010, and will be expecting further above inflation pay rises to compensate for that, which could put serious pressure on budgets going forwards. Question two is, will the government sustain its higher capital spending and use it well? So there has been a real lack of investment, and higher investment is key to addressing a crumbling estate, outdated IT, lack of equipment, and that's all harming productivity. But underinvestment has been a problem for decades, with significantly below OECD average investment on health, for instance, and it's well below what is likely to be needed to resolve all of the maintenance backlogs. Third question is, will the government successfully take a mission-led approach to the spending review? So this budget took quite a traditional approach, individual departments making spending bids and then negotiating bilaterally with the Treasury. That doesn't really align with the kind of joined-up vision of mission-led government, and that's a really key question for the next spending review, is how they make that process work differently to make sure that departments have incentive to collaborate and it's not a kind of zero-sum process. Four is, will the government shift spending towards prevention? So we saw some emphasis on prevention in the budget. And there's clearly a desire to move in that direction, but past governments have found that really hard to deliver in practice, with spending since 2010 actually moving away from prevention and towards acute services. And the current context of really challenging acute demand across a lot of services in criminal justice, in adult social care, in local government, is likely only to make it harder to shift resources from acute services into preventative ones. And then finally, what role will devolution play in improving public services? So the government has committed to multi-year funding settlements and consolidating kind of small ring-fence pots of money for local government. And that will provide local authorities with more autonomy and flexibility and certainty for planning their budgets. But that's not necessarily enough to deliver on a kind of more localised vision, if that is what the government wants to pursue. And there are a lot of unanswered questions about what that would look like in practice. So will there be a kind of reorganisation of subnational structures for service delivery? How will they be incentivised to work together? And how can disruption coming about from those changes be minimised? So we think these are all things that we're going to be looking at and thinking about a lot in the spring come the spending review.
Brilliant. Thanks, Cassia. Okay, so the team have given you their analysis of what the budget means for services and some of the big kind of questions and priorities for next year's spending review. We've got about 10 minutes for questions from you now. I'm going to take them in rounds of 3. I'm going to ask people to tell us your name, which organisation you're from. So who wants to ask a question? I've got one at the back here.
Alex Murdoch, I'm semi-retired academic. There was mention in the budget of zero-based budgeting, which I've experienced, and maybe some people here have as well. But zero-based budgeting can be a pretty major driver of change. Do you think it's likely to happen, and if so, where?
Thank you. One over here.
Thank you. Andrew Halderby, Effective Governance Forum. Just continuing that thought, the budget set up a value for money unit in the Treasury with a new independent chair. And I just wondered what you thought were the real opportunities for getting more value for money from the big spending increases in the departments that you research.
Brilliant, thank you. Any other questions in the room? Otherwise, yep, got one here.
Neil Brady, no affiliations except as a former NHS manager. Have you taken account of digitisation in your projections for both demand and resource need? Because it seems to me perhaps, with the digitisation perhaps of the courts and game-changing drugs for diabetes in the NHS, that there are potential significant improvements in terms of those equations you make. And I just wonder to what extent you've taken account of those.
Brilliant, thanks so much. Okay, so 3 questions. Zero-based budgeting, will it happen? Where's it likely to happen? Value for money unit and opportunities, and then digitisation. Stuart, I'm going to come to you first.
That sounds good. As a previous management accountant, I'd like to hear some zero-based budgeting discussion. Yeah, I think that it's a difficult thing to do in government. I think there's whole swathes of the budgets that are basically sort of protected and not really open to debate and discussion the way you really want to get into in a zero-based budgeting sort of approach. I think I'm thinking, for example, of staff costs. It'd be a big surprise to me if there was large reductions in staff costs after a zero-based budgeting round. But I think we've argued in the past that it's a more desirable approach to take in a spending review process. If they do it or not is a different thing altogether. How do you get better value for money out of our spending? We make lots of arguments about this. We think there are a few different things going on. We think there's probably a lack of allocative efficiency in government spending, particularly focusing on acute spending at the cost of preventative spending. So the pattern in the NHS for the last few years has been to pour more and more money into frontline staff. That has ignored things like management admin staff, it's ignored capital spending, and it's largely been hospitals at the expense of community and general practice. That's very, very expensive, and it's not arguably the right mix of spending. So we think there's some efficiencies we found from how you allocate spending across different parts of services. digitisation in our projections, we haven't considered it a whole lot. I wouldn't say. I think we've assumed more demographic demand increases as our sort of baseline. I would say in the NHS that when new drugs are brought in, it generally leads to more spending because there's now more treatment available, which is not always the expected outcome. So I think that it depends on what those drugs do, I would say, as to what the outcome is for spending.
Thanks, Stuart. Cassia?
Yeah, so I'll start with the digitisation question. In the courts, the progress of digitisation has been uneven and not necessarily that successful. I think we don't feel that it's justifiable to kind of make assumptions about the progress of that programme in terms of how it's likely to affect either demand or the kind of efficiency and effectiveness of the service. We have a kind of complexity adjustment within our police demand modelling that accounts for the greater volume of evidence, so things like digital evidence that is very time consuming to review. So it's something that we're thinking about and we kind of include that where we can, but it's often, we think it's not justifiable to make assumptions about the impact of things like digitisation programmes because it's not always as straightforward as it might seem in terms of improving efficiency or things like that. The value for money question, I absolutely echo what Stuart said. I think there's also some just kind of very basic things that drain productivity, and a lot of that is to do with like a lack of capital investment and things like that. If your ward is flooding or your kind of prison maintenance means that you're constantly moving people from cell to cell because they're flooding or they're not habitable, that creates a lot of wasted time and energy, and kind of over the longer term, you can improve your value for money by addressing some of those problems, but they're not really quick fixes, and I think that's the challenge there.
Phil?
I'd just come in on the digitisation point. I mean, I'd say it fits within the work that we do more generally on productivity at the Institute and things like service redesign and service reorganisation. In terms of schools, one of the areas where you're seeing schools having to respond to digital trends is around increased demand for home working and that being more available in most other professions. And so actually it puts schools at a comparative disadvantage when trying to recruit people if you know, it's hard to do teaching remotely. And so you're now seeing some schools, some academy trusts that are reorganising their timetables so that teachers can spend, you know, half a day at home when they're doing lesson planning and admin. So definitely something that we're looking at as part of our work programme.
Brilliant. Thanks, Phil. Okay, I want to take a few questions from online as well. Stuart, first one to you on local government from Grace Duffy from Bridges Outcomes Partnerships. Is the rise in local authority budgets enough given urgent pressures and increasing demand? Could greater flexibility for local authorities and how they manage their budgets help make that money go further?
I would say on the first part of that question, almost certainly no, it's not enough to meet demand. I think both demand in terms of rising demand for SEND, adult social care, children's social care as we discussed, but also the rising cost of delivering the same services for more expensive, for more money basically. So the next increase, the national wage increase, is going to put even more pressure on local authority budgets than not being compensated for that. So I think at the minute it looks like it's not enough. It's probably more of a stabilising amount this year to keep local authorities from toppling over. The second part of the question was about...
giving them greater flexibility.
Yes, greater flexibility. Yeah, we've argued for this in the past. We think there should be fewer small ring-fence pots of money for local authorities that they have to bid into competitively to try and get a little bit more funding. And we also think that there should be more longer-term settlements so local authorities can plan their spending more effectively over a long period of time. The government is committed to both those things in this budget. It won't be able to do it for next financial year because it's only allocated spending power for 2025-26, but it has committed to reducing the number of ring-fence pots of money, which we think is welcome, but there's also a tendency for new governments to come in, sweep away all the old ring-fence pots of money that the previous government announced, and then slowly build them up again over time. So there'll be the real test will be sort of 5 to 6 years' time on that one, I think.
Thanks, Stuart. Phil, we know that the attainment gap has widened since the pandemic. Is the additional funding going to schools likely to help close that gap?
Yeah, we have attainment gaps are they're at the greatest level they've been in more than 10 years since the pandemic, and I think it's reasonable to think that these disadvantage gaps will close over time, just as the pandemic sort of recedes into the rearview mirror. I think the new funding that was made available in the budget isn't going to make a significant difference on that.
And then, Cassia, I'm going to come to you, but Stuart, Phil, you might want to come in as well. We've talked about the importance of prevention in the spending review. What needs to actually happen in the spending review to make a kind of meaningful shift to prevention?
So Stuart's talked about our feelings about ring fences, but we think there is potentially a justifiable exception that having kind of dedicated prevention funding alongside a clear and specific definition of what you mean by prevention, like what counts as a preventative intervention, would really help in terms of easing, or I guess avoiding the impossible dilemma that services are otherwise faced with if they want to cut acute spending on acute services. We also think that there's an argument for essentially a double running, so that you are not cutting your spending on acute in order to increase your spending on preventative services, but you are accepting that in the short run you need to increase your spending on both, with the ultimate goal that you can then taper your spending on the acute as you successfully reduce demand in future.
Thanks, Cassia. Stuart, anything you want to add?
Yeah, I think that's all right. I think our work found that for prevention to really work, it needs extreme top-level political buy-in from both central government and also local areas that are implementing prevention. At the times it's worked best in the past, Sure Start, supporting families programmes, in local government when they're able to protect preventative budgets, it's because leaders have been able to make sure it's a priority, being able to hold services to account for that spending and to make sure that it runs through everything, basically. So I think it needs support from the very top of government, from probably Keir Starmer and Rachel Reeves, but then also Secretary of State to buy into it and to make sure that their allocations, when they reach services on the front line, are actually protected and directed towards prevention as well.
Brilliant, thanks, Stuart. Okay, we're already running slightly over time, so I'm going to have to end our quick fire round of questions to our experts here. Make sure that you all have time for coffee before the next session. So big thank you to our three IfG experts, and thank you to everybody in the audience, both in person and online, for the great questions. Thank you. You've now got a 10-minute break before our next panel starts at 10:45 on fixing health and social care. Thank you.